In phase 3, following a standard rotator cuff repair, the primary goals are to obtain full functional range of motion and to improve shoulder strength, endurance, and proprioception. Most patients begin this phase around the 12-week mark, and by this stage they have obtained around 120 degrees of elevation. The focus now is on more specific strengthening and to ensure patients can use their range of motion safely over longer periods of time. Range of motion in phase 3 should be done mostly actively and should include combined functional movement patterns. A lot of the range of motion work in this third phase is integrated into the functional overhand exercises your patient is already doing. If there are restrictions in the range, now that we're into this phase, we are allowed to introduce some careful stretching. And so this can be just simple PNF, a little bit of contract, relax, or you can introduce some low-grade joint mobilization techniques. So if on examination you determine that your patient has some selective tightness in either the pec minor or the posterior capsule tissue, you can begin some stretching at this stage. Most commonly when we stretch posterior capsule, we do it with a sleeper stretch. And so for that stretch, you instruct your patient to lay onto the affected side, ensuring that they're nice and stable and their scapula is set. Their elbow should be bent to 90 and the shoulder positioning is at about 90 degrees as well. Then you teach your patient to grab onto the arm above the wrist and to gently take the arm into an internally rotated position. Once they're at the end of range, they should hold that stretch for about 1 to 2 minutes, remembering that the tissue we're stretching is capsule, so it demands a little bit longer hold. Shoulder strengthening in phase 3 is going to vary as patients will progress at different rates. However, the commonalities for all patients are that the emphasis is on the rotator cuff and the scapular stabilization muscles. If these inner muscles are strong, the outer more superficial muscles will contract more easily and the strengthening overall will come back quicker. Strength exercises should begin with resisted isometrics with the arm first in a neutral position. All shoulder movements can be strengthened isometrically, including abduction. First steps are always to establish that excellent posture and to set the scapula in retraction and a little bit of depression, and the patient is instructed to hold this position while doing the shoulder isometric exercises. This exercise can be progressed by changing the angle you position the arm in. For example, the arm can be flexed to about 30 degrees, and the isometrics are performed in this position. The same can be done by changing the amount of external rotation. Early progressions to isotonic strengthening should be done with the arm moving in short arc, short lever positions. Long lever positions should be avoided for all strength exercises as they place far too much force on the healing rotator cuff tissue. These include exercises like holding a weight with the elbow straight and elevating like so, or doing the same motion with tubing resistance. So instead, good choices would be things like this, where the patient is doing a backward sawing type of motion with tubing. They can integrate a little bit of the shoulder blade, good posture. So it can be done in a backwards position. They can turn around, still holding the tube, and do forward sawing. And they can even do this into scaption. So if they turn their body a quarter of a way and do the same forward motion, they're working into scaption. We want to begin with our resistance strengthening in flexion and scaption and then progress into that abduction plane of motion. So a good initial exercise for abduction is to have the patient holding a very small weight or just the weight of the arm, elbow bent to 90. Have them really go through that initial step of setting the posture and the shoulder blade, and then abducting to about 45 degrees. You have to really watch because patients will be weak with this exercise, and they'll start to cheat and start to hike up their shoulder as they start to fatigue. And so they need to be corrected, and you need to make sure that you retrain the dissociation of blade elevating and glenohumeral joint abduction. Internal and external rotation tubing exercises can now begin in phase 3. 3 key instructions should be given with rotator cuff strengthening. The first is for the patient to set their posture, which includes setting the scapula. The second is to maintain the elbow at side, and a small towel helps to facilitate that. And then the third is at the wrist, to watch the wrist doesn't start to extend as the patient gets into a weak area and they start to compensate from that joint. So when patients can perform these initial strength exercises with proper technique, they can progress to exercises that combine joint movements that are more functional. Some of these exercises your patient has already done with their range of motion work, but now the focus shifts to strength, and so we can add some resistance and some repetition to encourage muscle endurance. So PNF or diagonal patterns work really well at this stage. And you can add a light resistance either with a weight or light tubing to add a little bit of the strength to the exercise. You still want to be working on that good technique, so the patient has to think about that timing so that their shoulder blade muscles and their trunk are working with this exercise. This exercise can be done first of all in supine and then progress to sitting on a ball, standing. You can get into even more challenge by having patients on one leg, onto a balance board, and so on. The other functional upper extremity kinetic chain exercises and closed kinetic chain exercises that your patient was doing in phase 2 should be continued into phase 3 and progressed accordingly. Exercises like PNF patterns, ball on the wall in a variety of positions, reaching exercises, and functional tubing patterns encourage all the components of good shoulder health. Range, shoulder girdle strength, the full upper extremity kinetic chain is integrated, as well as the trunk and even the lower extremity chain. Progressions to these exercises should include increased dosage, especially working towards muscle endurance, greater integration of the core and the rest of the body, and working into greater ranges of motion.